Welcome to the Moulding Private Practice Show, where we help healthcare practitioners in private practice keep true to their purpose and build a life of mastery by providing the knowledge, skills, and tools to bring their dreams to life. In this episode of the show, we speak to Leslie Faria Mendes about being a clinical psychologist and everything private practice management related. Leslie Faria Mendes, welcome to the show. We're really glad to have you on board. Thanks very much for doing this.
Thank you, Oliver. Thank you, Shaz, for having me here today. I'm really looking forward to being with you guys.
Yeah, Shaz outdid herself again. I mean, we were talking about it in the other show, talking about OCD, and she almost like read my mind, coming from the whole personality disorder stuff. But, that's a special area of interest for yourself. But today we're talking about how you became a clinical psychologist and private practice and all of that good stuff. So tell us, firstly, maybe ask Shaz, how did she come across you and twist your arm to be on the show?
Okay, so to be fair, I didn't actually really twist Leslie's arm too much. We connected a while back on LinkedIn, and when I was looking for topics for the Moulding Health show, I saw that Leslie specializes in OCD. So I reached out to her and asked if she would like to be on the Moulding Health show. And through that, obviously, we got the commitment to be in the Moulding Private Practice show. So thank you very much for reading your LinkedIn messages and kind of coming on board and sharing your insights with us.
It's such a privilege to be able to be on the show with you guys. It's an amazing thing that you guys are doing, and I feel very, very blessed to be here.
Thank you. Yeah, so the point of this show is, when and I'm going to ask you the question just now, but it's like when people are talking about private practice or they're talking about being a psychologist, it's there's lots of mystery around those topics, and it's almost like if you get the right mentor and if you get the right parent or the right person to help you guide you through it, that's amazing. But for most people, especially psychologists, for some reason, because most will go into the academic part, but it's amazing how many psychologists we meet. They don't realize that they have to do masters, or how difficult it is to get into masters when they choose, actually, I want to go down the psychology route. And the point of this show is to dispel some of that, so they can listen to Leslie and say, okay, I kind of resonate with that story, or it's interesting that Leslie did it this way. But the question I want to ask is, when you were like 4 or 5 years old, and sometimes, maybe up to 10, people always ask you this question. It's like, what do you want to do when you grow up? So did a young Leslie say she wanted to become a clinical psychologist?
No. Little Leslie, when she was in grade 2, I have this memory. The teacher was asking us, well, what do you guys want to be when you grow up? And I remember thinking to myself, oi, I do not know the answer to this question. And my dad had a friend over that weekend, and he had a fancy title for a job. So I just took that and I verbalized it, but I had no idea. And even when I was in grade 7 and my aunt asked me a similar question, I didn't have an answer. So I was never lucky enough to be that kid who knew what she wanted to be when she was little, or I didn't even know what I wanted to be once I had matriculated. And it was only during my master's training that it kind of dawned on me that I was going to be a psychologist. So I know that sounds a bit bizarre, but I knew I loved to study the content, and I knew that I valued connections. And so I applied for an undergrad in honors, and I got in. And then I was like, wonderful. And then I did that, and then I applied for honors, and I was like, wow, I got in. Amazing. Okay, I'm doing that. And then it was masters, and I was like, okay, cool, I'm going to apply. And then I got in, and I was like, what? And then I was sitting in my master's training, and then I was realizing, oh, okay, I am going to be working as a psychologist. This is what's happening. So my story is a little bit atypical. I never grew up working to be one.
You're going to make so many people so jealous right now, because they struggle, especially psychologists, to get into the master's program. We've had people that said, they tried for years, as an example, and the fact that you say you just got into honors and then you just got into masters is pretty impressive. You obviously did something right with that, though, to be able to get into those programs.
I think it's because becoming a psychologist wasn't my identity. I had this detachment from it. And even still today, I mean, I work as a psychologist, but I'm always trying to find another way or another job or another thing to do. I never had this psychology on a pedestal thing. I think maybe because of my childhood or where my family come from, it was just it was a job. I needed to pay the bills. But just so happens that I really do like this vocation.
No, it's actually really interesting that you say it that way, because there are a lot of people out there that actually aren't sure what they want to do and do wind up going to university and almost falling into the perfect profession for them. It doesn't mean that becoming a psychologist or a clinical psychologist is easy. As you said, there's undergrad, there's honors, there's masters, so it's a journey to get there. But if you wind up finding that thing you didn't know you enjoyed and actually get through it, it's actually amazing to hear somebody go, I didn't go to university and say I wanted to be a psychologist, but I kind of enjoyed the subject. And just because of that love and that passion for the subject, actually wind up in the job that you might not have thought you wanted to have anyway, but are actually really good at. So that's really cool to know.
I wish I had the maturity that other people have, where they know what they want to do and they even know that a psychology degree has a master's. I only figured out what the DSM was in honors year. I was so, I don't even know, lost, just like on another planet. That level of maturity is inspiring. I did not have it. And I don't necessarily think it's a good thing. But I think it's pretty amazing if you do have a desire and you go after it. I think that is far more commendable than my story of just summer arriving.
Yeah, although there's some level of intention there, because I think and maybe you're stumbling onto something, because I was trying to think, if someone really wanted to get into a master's program, like how would they do that? And I think they're making they're making it more and more difficult every single year, it seems, even to get into honors level right now. But I'm thinking, your approach to it, whether that was intentional or not, in terms of almost having this detached feeling to it, and because I think when you almost like invest too much in it, and this is like life or death, then I think it hurts a lot more, and you almost want to, and I think maybe people sense that. What I heard about the psychology board and how they pick people, they're obviously filtering that out. So however, and I said it earlier, but however you did that obviously worked, for that selection process. So yeah, all jokes aside, I think, the one thing, probably that we learned from that is almost don't take it too seriously. Like have that, almost, would you say that works?
The detachment?
Yeah, like I just find, it's like with people, when this is like a all or nothing, that's the feeling I got from some of the episodes. And I think, maybe having a different approach to it, maybe saying, actually, it's not so bad, like, I'm going to go down this route, but if it doesn't work out that way, then, I just try it again.
Yeah. And there's so many, I think for me, the goal was to help. And when you want to help, I don't think being a psychologist is the bee's knees. There are so many amazing, you could be a registered counselor, there are so many different things that you could be. And I love working with the different scopes, and even reflexologists. I think they have the most amazing impact on my clients. I don't understand it. I don't know why it works, but it works. And I think that maybe it's just, do you want to help someone or do you want to be a psychologist? And if you help someone, does it have to look a specific way? And why does it have to look that way?
I love
Because I
that.
think those questions are very important. I guess for me, I just want to help. I don't really care what that looks like.
We had someone on, her name is, it's an OT, her name is Tasneem Abrahams, and she was talking about, because she works in a special needs school or remedial school or something, and lots of those kids, they couldn't get matric, as an example. And they, like, when she would speak to them, she would say, like, so someone wanted to become a nurse, as an example, or a doctor, but obviously they couldn't because they couldn't get matric, right? And they would say, and she would ask them, so what do you like about being a doctor? And they would say, because I like to help people. It's like, and she would find an occupation, exactly what you just said now, which is amazing, is that when you peel back the layers, you can get to the underlying, what do you like about that occupation? And then you can find something, even if it is dressing the hoons. You're not a doctor, but you can dress the hoons, or I'm using it, and maybe a nonsense example there, but something like that. And and that's how she found that she could help those children, and
It's
that's amazing.
remarkable.
Yeah,
That is
which is exactly what you said.
Yeah.
I don't get reflexology as well, by the way. I don't get it.
I don't understand
just
that.
Doesn't make sense for me.
I don't understand anything. I'm just like, yay, it worked. And my clients are like, Leslie, it's better. And I'm like, yay, it's better. Better is better.
Agreed.
Yeah.
Sorry, Shaz, you were going to say?
So I was going to go back on I love the concept of I'm here to help, and it doesn't matter what packaging that comes in. Going back to the clinical psychologist thing, once you've done your master's, obviously there's that internship, ComServe period and so on. How did you find that suddenly going from, I've just kind of realized, okay, I'm going into a career as a psychologist, to I'm now doing community service? Some people have given us these wonderful stories about how they love their community service, and others have kind of gone, well, it was like being thrown into the deep end of the ocean without a life jacket. How did you find community service?
So fortunately for me, my master's program was 2 years. So the idea of being a psychologist had some time to trickle down and for me to process it. And for me, internship and ComServe was both wonderful and terrifying. I met the most amazing colleagues and I worked with the most amazing human beings, and I miss them. And after my community service year, I wanted to stay in government, but I wasn't one of the psychologists that was placed. I was one of the psychologists that went for interviews and didn't get placed. So then I became one of the duds. I was like, oh, she's the one that didn't get a post. And that's the thing. And it was just a part of my journey. And I think that really helped me to not get attached to the position afterwards. Because as you start to think, oh, wow, I'm becoming a psychologist, so your identity starts to merge with the whole role. Fortunately, the rejecting of not getting a post did a fantastic job in preventing that overlap. And then eventually, obviously, I got a post, and then the rest is history. But I found it probably just like everybody else has said, thrown into the deep end, but just so wonderful as well.
Yeah, I think it's, from everyone we spoke to, it's quite a, because you get the qualification, but you don't, you haven't really worked. And although it might be different with clinical psychologists, because as you said, 2 years, you do get some level of training as part of the internship. But normally, like when you get to community service and, you're in some hospital or psychiatric hospital, and now you get real clients with real problems and you have to help them, they're looking to you to do that. That must have been quite, I would say, difficult, but also liberating, almost like trying this is what you trained for. Did you find that difficult making that transition?
So in my first and second year of master's training, we were already seeing clients. We had a lot of hours to do. And then our internship year, obviously that was a 8 to 5 job. So by my ComService year, I had some footing already. We just had less supervision and so forth. I think it's always terrifying. You always doubt yourself thinking, oh my gosh, what the hell am I doing here? Am I going to even be able to help this person? Leslie, just act like you know what you're doing. Just act like you know what you're doing. So I think that's what I did. I think I got a poker face like no man's business. And then every day you would rush home and study the condition to try and understand. And that was challenging. But I think the first year of private practice was most terrifying for me.
Okay, so When you say the first year of private practice was the most terrifying for you, was that working in a practice with another colleague, or was that opening up your own private practice?
It was joining an established practice, but you would work like as your own person. People would be referred to you. You had to go do your networking. You had to learn everything. So it was a nice safety blanket, but it still entailed all the hard work. Yeah.
And so we, the other commonality we found with, doing many of these episodes now is that there's normally someone that appears as a guide or a coach or a mentor. Did you have someone like that as well?
No. Who are these people and where were they? Because I was on my ace.
You needed one of those magic lamps. Oh, I forgot.
Yes. Where do I get this lamp?
Apparently, it comes out in Master's Program. Okay.
No, I don't know. I didn't even know that was a thing. I feel quite sad now.
Okay.
Leslie obviously missed that day at Masters where they give out the mentor lamp.
Yeah. Where was I? Where was I?
Yeah, the genie lamp. Okay, cool. So no mentors, no coaches or anything around private practice.
I mean, I had the girl that I had joined her established practice, and obviously she was wonderful and she was able to explain to me, but you eventually have to learn all the procedure codes and what a P&B is and how to apply for that, and what codes. You just kind of drown and swim simultaneously.
Okay, cool. Oh, nice, easy break into private practice then. I think I mean, like what we didn't cover, there's obviously this gap, but we were speaking just before the show and I asked you, like, how long have you been in private practice? And you modestly said 7.5 years. It doesn't say, not that long, but that's a long time, in private practice. But I think, for me, what it means is that obviously you've ironed out stuff. You've managed to survive for 7.5 years because private practice is how you get your income, I'm assuming. And you figure out how to do the invoicing thing, how to get money in, how to get new clients, how to get clients to keep on coming without, you threatening them or anything. So lots of that hard work is already in place. But was that, in the first 6 months, if you take us through that, I know that's a long time ago, was there anything that springs to mind that you had as challenges?
I think that the learning curve during those first 6 months is so steep. Not only are you learning about a business and marketing and networking, but you're also learning about all the different conditions in private practice. And for me, I found that I needed to almost change gears as a therapist because the problems that I was helping with in hospital in the government sector were quite different to the problems that I was seeing in private. Plus, I was a grumpy Smurf. I actually wanted to stay in government, and I felt like I was being dragged into private because it was the only place where work was. So I now am appreciative for the fact that I've ended up in practice. I can see how it was a part of my calling, but I'm stubborn, so it takes me a while to learn things. So I would have to say that just learning everything and learning it all at the same time while trying not to burn out and having all these fears around being these self-doubt thoughts, that was just a really, really uncomfortable and scary time.
I can only imagine how scary it is because, like you say, you're trying to figure out how to run and manage a business. And at the same time, you're trying to figure out how to help these clients that are presenting with very different ailments to what you were seeing in government. Yeah. So with all of that, did you at any point then decide you were almost going to specialize in certain conditions? And if so, did you have to then take additional courses to almost be able to specialize in certain areas of mental health?
So once again, I am someone who didn't know she was going to specialize in OCD. It seems I have a theme in my life. I don't know what's happening in my life until it happens. But what ended up occurring in my 4th month of private practice, I was referred to a patient in a hospital. And I was sitting there with this patient and I had no idea what was going on. I remember the patient wasn't even maintaining eye contact. The patient was rocking. There was some tick behavior going on. And I had never felt so overwhelmed and so intimidated in my life. I wanted to cry. And I remember sitting there going, don't cry, Leslie, don't cry. And I tried my best to hold space. And when I got home that evening, I remember just typing the symptoms into a search engine because I was that confused. And then, boop, what popped up was harm OCD. And that started my journey. It was meeting people who suffer with OCD that inspired me to want to learn more about it. And so I started my journey where I was getting specific supervision into OCD, and I was working with some of the experts in the country so that I could get the necessary training that I needed. And so that's how the evolution occurred to the point where now I feel quite comfortable treating it.
That's amazing. As a follow-on question to what Shaz just asked just now is, do you find you have to work with certain types of practitioners to be a specialist or have a specialization in OCD?
Do you mean certain disciplines?
Yeah, like psychiatrist or, what I'm trying to gauge is like, so if someone listened to this and said, okay, although Leslie thought her part wasn't intentional, I love that part and I want to make it intentional and I want to, work with OCD clients, who would be in their referral network? Who would be, what would be the types of relationships that they would probably, want to, pursue?
So I would say that the OCD community is quite small, actually. There are specific psychiatrists that have specialized in OCD. There are specific neurosurgeons that have specialized in OCD. And so I would say predominantly it's the psychologist and the psychiatrist. And that manages the condition most. And then we will consult with a gynae if there is PCOS, and we'll consult with an endocrine if there is some kind of endocrinopathy or epilepsy. We'll refer to a neurologist. But it's literally just the psychiatrist and the psychologist and the back and the forth.
Okay. Another interesting question, and this might be, I don't think we've ever asked this, but I've always been curious, how do practitioners actually like work together in a virtual setting, from a multidisciplinary approach? We on lots of the Facebook groups, so normally I see, like one practitioner saying, like I've got this client and, she wants to see someone in X and there's a Facebook post for that. I mean, is there like do you guys like communicate over WhatsApp? Or how does this work? So if you're talking about a specific client, would that be like a phone call that you would normally have? How does that work?
So it depends on how much information we want to transfer. But I know with my specific psychiatrist, Greg, that we work together to treat OCD. With my OCD clients, I map out all of their thoughts in my mind. So if I know that Greg has increased the SSRI, I know 3 to 4 days after that, I should start seeing some changes. And I am able to reflect on those changes because I have an image of their cognitions from the previous session. I can then say to Greg, I'm seeing a reduction of the intrusions by about 20%. This is looking good. So that is the kind of feedback that I'm able to give Greg. And then that's how he's able to continue with his medication and the journey that he takes with the client. So for him and I, it's like a back and forth over WhatsApp. If it's more of a severe case, then obviously we'll go to his practice or we'll have a Zoom session and so forth.
Okay. And how do you keep track of that? Just like amazing memory?
In terms of your clients?
Yeah. So you said 3 days later, like did the SSR work? Like how do you keep track of that? I'm just curious, like, so what I'm trying to say, so if there was this practitioner and she wanted to specialize in OCD, I'm just trying to understand like what systems, she would probably look at or he would look at to be able to remember this, like, so my wife's a clinical psychologist and I always find every practitioner has this diary on their desks. It's the one thing that they buy, as soon as CNA or Exclusive Books, sells diaries for 2023, that's the first thing they buy. Is that something that you have as well?
Yes, guys, my diary is literally here, and it looks like, inside it looks like I doodle, but actually I write there all the exposures and the intrusions that we've burnt out and how long they burnt out. And so that's how I keep track of everything, not even so much in my notes, because the notes have more detail. I need those specific facts, and I need them all the time as I see the clients, and I just find in my diary is more effective.
Okay, that's amazing. As a team, we it's a very European standard, but in South Africa we don't think of it like that. We, in terms of weeks, like, so we know we in week 20 as an example, and I found the one diary, and it might have been an exclusive, where it mapped out like quarters and weeks, and I thought that was amazing. But I find, the reason I'm saying this is, with practitioners, yeah, everyone has their diary, like they have their own, tastes and stuff like that. But as a one certainty, and thanks for collaborating that story, but because it wasn't even that difficult, it was just like reach for the book, that's
Yeah.
amazing.
My diary is, it's on my, it's with me everywhere I go, unless it's like the weekend and I don't have it with me. But
Okay.
with every session, when I'm doing it online, it's right there. And my clients will be like, Leslie, what happened in our last session? What was the exposure? And I can go back and see what we did. And yeah, my
Okay.
diary is my memory.
That's amazing. Another one, and I kind of came across this, and it was like a mood diary. And then, like, so, people would like put in, like if they were struggling, during the day. I think this is mainly anxiety or depression related, but people would log a mood diary, and there's apps on the store, on the Apple Store, or maybe on the Play Store. I think that's what Android calls it, Play Store. Yeah, to do that. But is there things that OCD type patients, is there things that you recommend to them? It's like we spoke about intrusions, like you could have up to 20 intrusions in a day. How do they log that? Is there something that you recommend to them to do?
So initially, where we start, and before we have considered any kind of medication, it is quite scary to log intrusions, because one of the intrusions will be, and if I write this down or if I verbalize this, it's going to increase the probability of it occurring, and that's going to be my fault. So often I call it my WhatsApp diary. They will send me a dot, and then we can almost track how often they're having the intrusions and how many intrusions we're having in a day, what time of the day, and especially with girls around their cycle, at which point in their cycle are they getting more intrusions? Are they more graphic? So that really, really does help. And some of my clients who are a little bit more technologically savvy, they're able to make a whole graph for me and show me how their intrusions wave and how it affects their mood and their impulsivity. And they're just amazing. And it really helps them. It gives them almost like more information about themselves that they find helpful.
Yeah, because I can think that that's quite complicated. I mean, like, you spoke about the medication. Now we spoke about, the ERP or the CBT or the therapy part to it. And then you have, like life happening at the same time. You almost like need a way that you can almost like map this.
Yes.
I would love to
Yes,
see something like that.
especially sleep. So I know that one of the leading companies in the world for tracking sleep and mental health is MediBio. They're an Australian-based company, and they often use, if you follow them on the internet, they often use Apple, Garmin, or Fitbit. And I always encourage my clients, especially my OCD sufferers, they have to track their sleep, because they need to have a certain amount of deep sleep and they need to have a certain amount of REM every night. And we can see how that affects their intrusions and their compulsions if they don't.
So actually, really, that's quite interesting. Obviously, being able to track the sleep using other devices. So obviously, at some point when you were specializing in OCD, it comes out that sleep is very important.
Yes.
Now, what happens then if somebody doesn't want to track their sleep? How do you keep your notes of what's happening with that patient? Aside from the diary, obviously, you have to have your actual clinical notes. Do you use a software or something like that to store them safely, or big filing cabinets?
A massive filing cabinet. I wish I was so cool to have something electronic, because that does sound so cool and it sounds very MacGyver-ish, like very technological. I would love that. And I would love to be able to, share that information with my clients, have them, because the notes are theirs. I mean, that's what the health profession council says. These notes are you. It's not me, it's yours. And I would love something, especially because of OCD, and it's always about writing down the exposures. There's never anything in my notes that I have to worry about my clients seeing and it compromising their recovery in any way. So for me and my skill set, I think having that almost like a door where the client can come in and I can come in, we can access the notes and see what we did in the last exposure and how quickly they habituated and the homework that they did, and they could give me that information. Guys, that would be amazing.
Okay, cool. I'm glad you said that. I mean, like, so we, we've been working on, we've been working with practitioners now for like over 9 years, but, we always started with the billing side. We didn't even cover billing as yet, but I'd love to go into that and see how you invoice your clients and what software, how did you choose the software? Hopefully you don't handwrite them, or use Excel or Word or something, but so there's a process with that. But I think the one thing that we started seeing in the market is, and it started with like people that worked with children, but I always thought it would be amazing, because if you look at what Apple's doing, in terms of tracking sleep and all of that stuff, there's something about knowing that, and like you said with your clients, plotting all of that and then making sense of that, and then having amazing people like yourself that can guide us through that journey as well. And yeah, that must be incredible. So I like how you mentioned it as well. Door, come here, do something, leave.
Yeah.
We must think of that in terms of explaining it. So we think of it as shared notes. That's our term. It's not as cool as thinking about it like.
No, I think shared notes sounds more professional. Door in. I mean.
Yeah. But it was a cool way to explain it. Billing software. Did you find it quite difficult to come up with an idea of what you needed to do? I don't know if you deal with medical aids or not. You mentioned PMB, so I'm assuming some level of medical aids. Because I think that's the one thing my wife struggled with when she started her private practice, was just how do you get the invoice out? And I think the one thing, I told her in the early years as well, if you don't get the invoice, you don't get paid. That's how the world works, like they don't know what to pay you. So our clients won't pay her for 3 months, because there's no invoice out. Did you have any of those fancy stories too?
So when I joined the established practice, the lady who I worked with had a billing software. Fortunately for me, I have a company that does my billing, and she uses GoodX, and I only found that out the other day when I asked her because of this interview. I didn't even know. So I think for me, I needed someone to manage my billing so that I could focus on my clients. And clearly I can't multitask because my brain was just like, that's too much. I'm going to have a nervous breakdown if I do both. So Lizelle is my lifesaver, and she manages that so that I can focus on the therapy.
I like that. I like how you said that as well, because that seems to be the differences in the, like with most practitioners. Either you do it yourself, and that implies you have the software and you know how the software works, and you can do that stuff, or you have someone that you pay, like a receptionist or a personal assistant that does that, or you outsource it. And that seems to be the trend in the market, and I don't think I've come across another. There might be a hybrid somewhere there, but that seems to be the common part. I like the outsourcing part, because like you said, as long as you realize that you still keep responsibility, I think that's something that practitioners struggle with at some point, but you still keep responsibility, but you do have someone that specializes and does it for you, which is a really cool model.
Subscribing to all the POPI regulations and all of those things. It's just, it gives you peace of mind.
I like that.
So just on the following up with the thing of having stuff like the billing and the unpaids and that kind of stuff outsourced, one of the things you mentioned there was it allows you to focus more on the healthcare aspect of it. Did you find when you kind of first started that having to focus on the business and the healthcare almost detracted from being able to help your clients, or was it just a case of, I really don't like admin and it's just easier for me to let somebody else do this?
it was, I am so bad at admin. It's in everyone's best interest if somebody else does it. Yeah.
You'd be surprised. We met quite a few practitioners, psychologists actually, that actually love the admin part.
Wow.
Yeah, I know, it surprised us as well. But we found it was mainly they worked before, like they actually had their whole Excel book sorted, and yeah. Hey, Shaz?
They are amazing.
I
Are those
know.
the same psychologists that got the genie lamps?
Yeah, must be.
Exactly. Yeah. The same day they were handing that stuff off. Maybe it was a separate lamp, actually. The special skill that you get.
But I think there's a very clear defined definition, though, because there are some psychologists that have that real ability to manage the admin and manage the patients and do all the reports and do all of that, and they're really on top of it. And then you have the other psychologists like yourself that just, it's best for everybody else's interests if I'm nowhere near the admin.
Yeah.
I haven't really found that nice middle ground where, I'm great at the admin and I'm great at the patient care, and, it kind of all fits well. So, it's nice that there are options out there for psychologists and healthcare practitioners of, if admin isn't your strong suit, there is options available. But again, just that knowledge that you still remain responsible for what happens. So like you said, if you have outsourced, make sure that all the POPI compliance is there, that you know what's happening with the person or the company or whoever you've outsourced it to, because at the end of the day, it's about that patient experience. If the patient has a great experience with you in therapy, but a really bad experience with the admin side, that's going to affect your practice as well. And we've got to remember ethical standards of, you've got to run your business ethically as well as treat people ethically. So I think we've always got to keep that in mind when people are making that decision of, do I outsource or do I do this myself?
So we're going to close up shortly, but I want to ask Leslie, is there anything around being a clinical psychologist or going into private practice that you wish, like the lamp part, is you wish someone told you, like, I wish they told me this, around being a psychologist, or I wish they told me this about private practice. Anything spring to mind?
I think my journey has been quite specific in that I've only really discovered things as I went through the process about myself. But I think I would say be open-minded. I remember in my master's year, I was sitting there and I said to myself, I am never going to deal with anxiety disorders. Fast forward a few years and here I am specializing in anxiety disorders. So I think that what that said to me is that I was closed-minded because I was so afraid. And one of my mantras when I work with my anxiety disordered clients is walk into the fear. Sometimes the things that you're most afraid of is exactly where you should be looking. And I know that that's something that Jordan Peterson often says. So I think if someone had to say to me, Leslie, you're going to end up in anxiety disorders, I'd literally probably start shouting at them or tell them that they're having delusions, or so maybe I wouldn't even have been as receptive, but I'd probably just walk into the fear, Les. That's where you'll be most happy.
I love that saying. I don't think I've heard that before, actually. Someone else mentioned Jordan Peterson. I haven't followed his stuff, but yeah, I love that one. We have a few of those sayings in the company, but we can add that one to one of the company values is being brave, but this ties into that. It's like bravery, walk into the fear.
Yes, walk into the fear.
Very cool.
It's actually one of my mantras. It's one of my New Year's resolutions, actually. Walk into the fear.
Nice. Shaz, on your side, anything that we should have asked Leslie that we didn't?
Only thing that I think we didn't ask is, Leslie, if a young person thinking of going into psychology came up to you tomorrow and kind of said, I'm really thinking of going into psychology, what would you almost say to that person to kind of advise them on going, you're going into psychology, this is kind of what you could expect. Now, what would be that one nugget that you would give them to kind of go, yeah, this is for you?
So I would just trust the person that the reason why they want to study psychology is because they know that this is what they want. So the nugget that I would give them is I'd tell them to think bigger and think outside South Africa. I mean, if you take your undergrad degree and you go into America, after 5 years of studying, you come out with a PhD. So I would say to them, South Africa isn't the only place where you can study to become a psychologist. Think bigger. You can go and become a psychologist anywhere in the world. And if you do your PhD in America, the universities, your degree is paid for. You don't even have to pay for that. It's subsidized. So that would be my recommendation. If you want to follow your heart and you want to follow your dreams, it doesn't just have to materialize in South Africa. It can materialize anywhere.
I love that. Is that for foreign students as well?
Yeah.
In terms of the subsidies? Oh, wow.
Yeah. Every PhD program from the research that I've done, it's subsidized because the PhDs are all research-based, and it's remarkable. It's when I first found out, I was like, so definitely to do the research and also to apply for funding. I mean, I think to think big is just, it's a privilege that we can have, and to be able to do that is amazing.
Yeah, and I think in the last few years we realized how small the world is. You know, like as COVID was shutting down, it was interesting watching all the countries follow suit. You know, like when it was shutting down in New Zealand, it was shutting down. All of the borders were shutting down at about the same time. You know, so definitely, I love how you said that, and I think for anyone listening to this, I think many people are going to be getting some ideas. But yeah, I didn't actually know that. I actually thought it was always, you know, like foreign students were treated kind of different. You didn't get subsidies unless you got a grant or something. But that is.
So maybe you are right. I could be wrong, and I would still say don't let that stop you. Apply for a grant. Apply for a scholarship. As South African students, we come from a developing country, and people want to invest in us. So don't give up. Don't give up. Don't let South Africa be the only place where you think your dreams can come true.
Love that. So your Nunus are very fortunate to have you on and helping them through life. So I really, really thank you very much for your time. Is there anything that you think we should have asked you that we didn't? Or any closing thoughts?
No, guys, this was amazing. It was a pleasure to meet you both.
Sure. No, the pleasure was all ours. Thanks very much.
Yeah.
And thanks very much for doing this.
My pleasure.
Thanks very much, Leslie. And it was amazing to meet you too.
Thanks, Shaz. Thanks, Oliver. Have a wonderful week, guys.
Hey, everyone. Thanks for listening. As always, stay tuned and we'll speak to you in the next episode.